And so we'll go ahead and get started this evening. And my name is Sarah. I forgot to introduce myself, and I'll be the moderator this evening. I'm very proud to introduce Dr. Mark Mason, who happens to also be my husband. And he is the medical director and the president of Southlake Plastic Surgery. He's been in practice for 20 years, and he's going to be introducing the panelists for this evening, as well as introducing what we're going to be talking about tonight. So Dr. Mason, take it away.
Okay. Hi, everybody. Thanks for joining us tonight. And hopefully you're getting your computer or your iPhone or other device to work. I grew up back in the day when we had slide projectors, so this is all new to me, Zoom and webinar. Anyway, tonight we're going to have an exciting discussion about medical grade skincare because we have a new line at Southlake Plastic Surgery. And the staff is going to go over these products with you in detail. And I consider them to be the experts, and I learn from them. So pay close attention. I'm going to introduce everybody, and they're not necessarily in the order of importance. First is Amy Sanders, our nurse practitioner. Ashley Crocker, she's a licensed medical esthetician and certified laser technician. Sonia Corbin, she's a licensed medical esthetician and certified laser technician. And Lindsay Van Meter is a certified aesthetic nurse specialist, and she's been with the practice for many years. So I'll turn this over to them.
Okay, thanks, Dr. Mason. And I just wanted to let everybody know that Kelly Presley is part of our team as well, that she is not going to be joining us for our webinar, but that does not mean that she can't help you with your skincare needs when you're in to see her for your injectables. Kelly also works as our clinic nurse in the surgical side. So if you're seeing Dr. Mason or Dr. Wan for surgery, you'll run into her there as well, and so she can help you with your needs there. So we'll start off with Amy Sanders, our nurse practitioner. She's the one that oversees all of our patients over here in the med spa. So Amy, go ahead.
Hi guys, I'm Amy Sanders. I'm the nurse practitioner here at Southlake Plastic Surgery. I'm in charge of looking over and checking off on all treatments that are performed in the spa. And I also brought hormone therapy and some miscellaneous dermatology techniques to the practice as well. So you may have already met me, and if you haven't, say hi next time you're in. So today I'm here to introduce our new skincare line. In a minute here we'll announce prize one, but I'm going to go to this next slide so you guys can see some of our products. So there's this beautiful, nice, bold, white and silver product line, and it's Southlake Plastic Surgery. And we're proud to introduce a few of the specialties here, which the estheticians and our RN Lindsay are going to introduce here shortly. But you can see we have two different moisturizing agents. One's for oily skin, one's for dry skin. We have some skin tone management agents, which is a fancy way of saying a brightening agent for any kind of skin dyschromia or discoloration, sunspots, anything you want to brighten up. Even some leftover acne scar pigmentation can be fixed with some of these. And then we also have a really, really great sunscreen. It's completely mineral-based, which I'm a big fan of if you have sensitive skin to the chemical components such as oxybenzone and a lot of our over-the-counter copper tones and Neutrogena sunscreens. And then we also have our own neck factor, which is good for tightening the neck, which everybody wants, as well as we have two of our own retinols. So we have a 0.025 and a 0.05. And then when you're ready to graduate to the 1.0, we will actually talk about doing a prescription with myself. So to kind of give a little overview before I turn it over, our product line is medical grade. So medical grade means that it's formulated in a lab. It's a little stronger than your run-of-the-mill over-the-counter product, and it's designed to go deeper to achieve more dramatic results. This is something you'll want to meet with one of the estheticians or nurses or even myself here to discuss what's perfect for your skin type, because it can be a little more irritating since it is a stronger product. If you're curious about any of the pricing, if you go onto our website, it does list everything. So if you have any questions about that throughout, you can ask and I'll answer, or you can go to our website. Next, I'm going to turn it over back to Sarah to announce our prize one.
All right, so the first winner tonight is the C-Cleanse. Thank you. And here it is on this slide. So C-Cleanse is something that's great for normal skin. It's for all skin types. It's an antioxidant cleanser that leaves a very light film of vitamin C on your skin. So it's great to keep working all day long. And again, you can use it for any skin type, and it's gentle. Again, it has no perfumes and no parabens, so it's really safe for you. So Christy's going to draw the first name, and this is to reward those of you who signed in on time. So let's see who the winner is. And the winner is Jamie. The next panelist is our laser tech and medical esthetician, Ashley. And Ashley's going to talk to you about Bright Night.
So I'm going to talk about Bright Night tonight. It is great for uneven skin tone and melasma. It has kojic acid, vitamin C, and vitamin E in it, which is all active ingredients that are going to help brighten the skin. But the thing that makes this so special is that we can add 2 ingredients. So we can add arbutase, which arbutase mimics hydroquinone. And I'm sure most of you know that hydroquinone is a lightening agent, but you're going to get the benefits without the harsh side effects of the hydroquinone. It's great for all skin types. You can use it morning and night. But another great thing about it is we can add retinol in it, so you can get the exfoliation. So you can get it for $175, and you're getting 2 lightening agents, vitamin C, vitamin E, and a retinol. And why I like it the most is because I've tried many, many different lightening creams. I too used to suffer from a lot of pigmentation, and this was the only product that has made a difference in my skin.
Thanks, Ashley. And she is well acquainted with this product, as she has already sold out of the Bright Night once, and we're on our second order of Bright Night. I use it every night. Dr. Mason uses it at night. I actually have the arbutase in it because my skin tends to hyperpigment in the summer, and so this has really kept my hyperpigmentation under control. I think you'll love it. It feels so luxurious when you put it on your skin. The next prize is CEF 30. This is the equivalent of SkinCeuticals CEF Ferulic, only better. So it's an antioxidant similar to CE Ferulic. It has a higher concentration of the equivalent of 20% vitamin C. So you put it on at night, and it is a very silky serum in a fat-soluble vehicle. So this makes it feel really good, and what it does is it helps repair your skin overnight. This is a value of $150. So it's a really great product. It's in a brown bottle because it is an antioxidant. We don't want it to oxidize with the outside air. So the winner is Nina, because we don't want you to waste what you have at home. Go ahead and use what you have, but then we can combine these with your other products, as well as any laser or light procedures you might want to do, and you can do them safely in the summer. You just need to know how to use them and how much to stay out of the sun. And then this is why our providers are so well versed in the procedures and the products, and they can help you out.
Real quick, Ashley, we had a question about the Bright Night. It's a question asking how long do you need to use it to see the results?
You should start seeing minimal results in about 2 weeks, and really start seeing results in about 4 weeks. That's using it morning and night.
There is another question about the CEF 30, because we aren't going to be talking about that in detail. They want to know, does the CEF 30 contain folic acid? And I believe it does not, but can you answer that?
Folic, no, ours has the ferulic acid, and then it's 20% vitamin C with the E for moisture, because the C can be a little drying. The ferulic acid helps boost the actual effect of the E and the C in your skin.
Great, thank you so much. All right, the next prize to give away tonight is Mineral SPF 40. This is our medical grade sunscreen, and we actually have 3 different types of sunscreen. So this is a broad spectrum UVB protecting sunscreen. It's fragrant and preservative free. So in other words, it has no perfumes and it has no paraben. This is often the cause of contact dermatitis in people who are sensitive to different sunscreens. And so this will prevent your sensitivity and allergies if you use our sunscreen. Mineral SPF, it's feels, again, very luxurious on your skin. So let's see who the winner is. Ellen, our next panelist is our medical esthetician and certified laser tech, Sonia Corbin. Many of you might have known her when she was with us a few years, several years ago, and she was with us for many years. She took a slight sabbatical, and now she's back. So I know a lot of you are excited to see her back. Thanks, Sonia, and she's going to be talking about neck factor tonight.
Hello, everyone. It's good to see you out there. Yes, I wanted to talk about neck factor. I'm happy to talk about it because to me, it's one of my favorite products that we have. Who doesn't want to keep their neck from aging in the future? To me, that is just so important, as our skin, but it's all important to me. So with the neck factor, the great thing about it is that it has a lot of antioxidants in it. It has the hydroxy acid ester and a retinoid. It has your vitamin C and E, and then it also has peptides to smooth and improve the texture of your skin. So retinoid that's in it is specially formulated for the neck area and will help reduce the redness that you see a lot of times in your neck. So along with that, it has the growth factor carnitine, which also helps with that. Carnitine is primarily used topically for anti-aging preparation. So if you've got carnitine in a product, it is a growth factor, so it's going to help overnight heal the skin. That, along with the retinoid, is going to help heal your skin overnight. And then in the morning, you want to be sure and get up and put on your SPF, your broad spectrum sunscreen. So you use the neck factor every night to heal the skin, and then every morning, be sure you use your SPF as you should all over your skin, of course. But for me, that's just one of the main things, is taking care of our skin and our neck. And so I'm happy to be able to talk about that. And I will say, we used to sell what we call the Nectifirm, which is by Revisions. It was a good product, but the thing about this one is that it has the retinoid in it, and it also has a higher concentration, of active ingredients. So you're getting more for your dollar, and you're getting better results. So please come check us out. Be glad to talk to you about any of the products. And just to let you know, this is priced at $125. Thank you, and I hope you all have a good night.
Thanks, Sonia. And the nice thing is that Sonia also knows a lot about our SkinMedica products, because one of our questions tonight was, I'm so excited about these products. How do they compare to the other skincare lines you carry? And I think that this is a prime example. Neck Factor is our medical grade version of Nectifirm, which is really popular. And we're not saying that those don't work, because we think very highly of those products, as we do of many of the products that we carry from SkinMedica. We're still carrying the main products for SkinMedica and Elta MD, but medical grade, as Amy had told you before, those are products that have a higher concentration of active ingredient. So this is why we've decided to carry this. We know they work. They're going to work faster. They're going to work better for you. We are going to be talking about other products as well. We'll try to compare them to things that you might have already been using or you've heard of. There's nothing wrong with them. We just feel like these are better.
To kind of piggyback on that, I like to tell people, you can spend hundreds of dollars on a product, but if less is more, you actually end up saving money. So that's one way I like to really present medical grade products is, you spend the money once, and it's actually, you don't need to use as much to get a result. It's going to last you a little longer. And I also want to answer the question that came through about the sun protective factor in our other products. The only thing with sun protection in it is the sunscreens. So you always want to put all the products on first, and we can go through what order you put that on in when you come into a consultation. But you want to always finish with the sunscreen, because that's where you get the sun protection.
Great. Thanks, Amy. That's really important too, because sunscreen is actually one of 2 FDA approved anti-aging products. Those are the retinoids and sunscreens are the 2 actual FDA approved anti-aging agents, which most people don't know about. All right, it's time for our 4th giveaway already. So this product is called Moisture Sheer. It's a moisture enhancer. You can use it for any skin type, and you can use it under your other lotions or any other products you might be putting on. It does not feel oily or greasy. So it decreases fine lines and wrinkles, and it's perfume and paraben free. So again, those products that you might be sensitive to, it's due to the parabens and the perfumes and the other preservatives that other products put into the formulation. This is like a drink of water for your skin. This is what we like to say. So I think you'll be really excited to try the Moisture Sheer, and the winner is Suzanne. Even people with oily skin need to be hydrated, and so this is perfect for you even if you have oily skin. Lindsay is our next speaker, and as Dr. Mason mentioned, she has been with our practice 8 years now. She started off as our clinic nurse, and then she was our operating room nurse, and now she's one of just a handful of certified aesthetic nurse specialists in the country. So Lindsay, why don't you share what you would like to share tonight?
Thank you, Sarah. Thanks everybody for joining. This is pretty fun. Who would have thought we could do this? Okay, so I'm going to talk to you guys about a melasma peel, because that was actually my personal introduction to this line. I didn't even know what melasma was until I had babies, and if you know, then you already know what I'm going to say. It's the brown pregnancy mask, hyperpigmentation. I got mine most predominantly on my forehead and above my eyebrows. A lot of women get it above their upper lip, and it can be really embarrassing and look like a mustache in pictures. And so my introduction to this line was the melasma peel, and Ashley did the melasma peel on me in the fall. And there's no cure for melasma, but this is the best way to just wipe the slate clean. It's a very strong peel. It's done in the office. It's 14% arbutase and 10% retinoid in that peel. So if you are on, like Amy was talking about earlier, the strongest retinol at home, which you would have a prescription for, that's 1.0. So this peel is 10 times as strong as that. And basically one of our estheticians will put it on your face, and it's white, and you go home with it. It looks like you put your put your face in a pie and you have whipped cream all over your face or something. But when you leave, you'll go straight home and leave it on for 8 hours, or actually leave it on for as long as your esthetician tells you, because it's formulated and specific for your skin type. But I left mine on for 8 hours, and then you rinse it off with cold water and expect about 7 to 10 days of downtime. Most people start to peel around day 3. I was a little bit later than average. I started peeling around day 4, but it just sheds those pigmented cells and suppresses the melanin production, because we know that with melasma, it will always keep coming back. Even if you're wearing your sunscreen, even if you're like me walking in with a big floppy hat at the pool, if your arms are exposed at all, your melasma is going to come back. So it's a good yearly treatment when the summer's over to get that done. What comes along with the treatment is the at-home care, which is this line of products. So that was, like I said, my first introduction. And you keep up with that at-home care for 6 to 8 weeks. And that's when you see your ultimate results from the melasma peel. The other thing that's nice about this, like I was saying, how long you leave it on your skin is dependent on your skin type. This is really nice because it's available to all skin types. Some people are limited and can't do lasers or light treatments because their skin tone is darker, but this is an option for people with all skin types who have darker hyperpigmented areas. So that was my introduction to the line. I love it. I love the peel. I love the at-home care. I've tried a lot of tinted sunscreens, but the sunscreen that comes with this, our sunscreen, is the best by far. I love it. So I know you'll all love it too.
Great. Thanks, Lindsay. And I think it's really important to know that all of us use the products. We have procedures done here all the time. We're the guinea pigs for everything because we're very skeptical of new items that we bring in. So we're always wanting to try it first. And this is why we have chosen to go with the melasma peel that we carry, which is the medical grade peel put on by our estheticians and Amy, who they know how this works. They know how to treat you, and they know how to deal with any side effects should you have any unexpected side effects from any of your treatments. I'm going to go back to a question. One question is talking about the neck factor. Does the neck factor only rejuvenate, or does it also lift? Who would like to answer that question?
It also lifts. So it does the same as if they did use the Nectafirm before. It will lift and hydrate and rejuvenate the skin. So all of the above. Because it has the peptides, the vitamin C, all of it improves the texture and helps tighten.
And I'd like to piggyback on Sonia for that too. Another thing, even though it's not on topic with our skincare for tonight, but another thing that we offer in-house here is Botox treatments for the neck, and that helps with skin tightening too. And then of course, necklace with Dr. Mason. But there's kind of different levels, different stages that you can do, and this is the best thing skincare-wise you can do for your neck. And then if you're ready to take it up a notch and you want to do some neck Botox treatments, we can do that in the med spa as well.
There's
Perfect.
also retinol in the neck factor as well. So that's where you're getting a lot of that collagen, the turnover for the, the baby fresh skin, and then also the collagen production with that retinol that's in there too.
Great. Thank you so much. Those are really good answers, and appreciate you explaining what you can do besides just the product. One thing that Dr. Mason always tells his patients is that your skin is the largest organ of your body. So your skin is there to protect the rest of your body, and it protects you from infection. And so wouldn't you want to protect your skin, whether it's on your face or your hands or your body? It is protecting you from all kinds of infections and diseases. So this is why we're so big about really good quality skincare. We want you to spend your money so it actually works, rather than buying something at the drugstore that doesn't work.
I was just going to say, and also with the retinols, which is so good, and it's what I usually tell, most of my patients, is retinols, they rebuild the collagen. So even if you can use retinol every night, which ours, the new one, the SPS medical grade one, is time released, so you can alternate that. It doesn't seem to be so, you're not so sensitive to it usually. But one thing I can tell you is if you get on retinol and you use it for a long period of time, start it and just keep using it, you will see some really good results with it, because it does rebuild collagen and it helps with those pores also.
That's a good point. Great. Because we always hear just what retinol does in one aspect, but it's good to understand that it does more than just one thing for your skin. It's actually helping. Collagen is the fiber that actually makes your skin healthy and plumper looking and fresh, right? Who has won the $100 gift certificate? This is going to be good toward any product here from our medical grade line. And so really our products are really well priced. I know that you can spend up to $200-300 at Nordstrom's on their non-medical grade products. I think our highest priced products is the Bright Night, which is $175. So these are really well priced. They're in almost we have something for everyone's budget. And the winner of the $100 gift certificate is Kathy.
I had a question come through. I'm going to give this one to Ashley. They're asking if you can use the melasma peel for age spots on your hands.
I would not do a peel that strong on the hands, just because the skin on our face is a lot thicker than off the face, our neck, our arms, our hands. So no, I would not recommend doing the peel off the face. There's other things that we could do, such as halo or BBL to the hand.
Amy, I see a question too. Is there a difference between the medical grade Southlake Plastic Surgery vitamin C that's contained in our products and other brands?
So one of my favorites to compare it to, I'm a big vitamin C user. I love how it's brightened my skin. As quick as 3 months, I noticed a difference when I started using it about 2 years ago. I used to be a big SkinCeuticals user. They're a pretty high-priced product, and high price doesn't always mean it's the best, but typically when you're looking at a vitamin C serum, you're looking at over $100 for one that's at least 20%. So you want to look at the percentage. You want to look at what it's formulated with. Ours has the ferulic acid to boost the effect. It's in a light protected bottle. It has an expiration date, and it has the vitamin E to help moisturize, because some people get too dry with it. But one of my favorite things is I get results with it because I used to use SkinCeuticals, and the SkinCeuticals has this really horrible smell to it, and ours has no scent at all. So I'm a big time user of ours now, and I used to be a big SkinCeuticals fan. A lot of their cleansers have vitamin C as well, and we have some comparable cleansers in our line as well. So I know our personal line is coming from a pharmacy that we work with for our melasma peel. So, we trust in their formulations. They have expiration dates. Sometimes things you buy say they don't expire. A vitamin C is going to expire. So I've been a bigger fan of ours than some of the ones that you spend $200 on that, come out with SkinCeuticals or Skin Science or some of those.
Great. And then we have another question about the melasma peel. I assume this is regarding the melasma peel. Can you use it if you don't have melasma? For example, I don't think I really have melasma, but would someone be able to use it just to give yourself a good glow?
Absolutely. I love peels for acne pigmentation that's been left behind. You can do it for sunspots, fine lines. It's going to help with fine lines and wrinkles. Melasma is where you really get those wow before and afters, but if you've got some dark sunspots, it's going to do the same thing for those.
And then another question, sorry if I missed this answer, but how long does one bottle of retinol last?
Retinol will last anywhere from 3 to 6 months.
And how often would you be using that to last that long?
At night only, 2 full pumps. Yep. And you can also use it on your neck, from your hairline to your bust line.
Can you put it on your chest as well? I mean, on your décolleté as well to rejuvenate that area?
Yes, but I would only recommend the 0.025 for that.
Okay. And that's because your skin's so much more sensitive there, is that why?
Correct. It's a lot more delicate on our neck and chest.
Okay. Amy, did you want to explain how we were going to be setting up our consultations?
Absolutely. So I'm going to click through the last few slides here. They kind of give an overview of what you might see when you come into a consultation. We're going to assess, your skin type. Are you dry? Are you oily? Are you combination? Are you worried about acne? Are you worried about your rosacea? Are you worried about pigment? And we're going to come up with a personalized plan for you. So you might see something like this next slide here. This is a dry skin protocol. It breaks it down by morning and night. And you can see where there's alternating products. It tells you the exact order. And we can change these around to best fit your need and kind of talk to you about, what retinol percentage is right for you. Where do you want to start? We don't want to go out of the gate with a 0.1 or a prescription if you've never used one before. So that's something that we can address in the consultation so that you don't buy these products and then you're unable to use them because you're getting too irritated. So I'll just click through a few examples here. And I didn't show the pictures, but we carry 4 different cleansers. So there's one that's real similar to the Aha Baha cleanser by Skimedica. So it's got both alpha hydroxy and beta hydroxy acids like glycolic and salicylic and lactic. Really great for, oily or acne prone skin. And then we have a sensitive cleanser real similar to SkinCeuticals that has a little emollient it leaves behind, and it's not going to irritate and bring out the redness in a rosacea patient. So those are also things that we can talk about in your consultation that we didn't cover today. So if you want to schedule a consultation, you can meet with any of us here. You can text or call our number below, or you can even email tonight and we'll get you on as soon as we can to come meet in and get the products that you need.
We have another question here. Are there any negative implications when transitioning to new facial products? Do you recommend that we consult with you all prior to making any changes to our regular skincare routines?
That's definitely something we would cover in the consultation. If you're going to come off of something such as a really heavy duty cleanser that may have been controlling your acne, something recommended by a dermatologist, we'll go over what you're on when you come into the consultation. There's a form you'll fill out where you actually list everything. So yeah, there are some products that you'd kind of want to come off slowly, or make sure you find the alternative to that if it's trying to treat a specific type of thing like melasma or rosacea or acne.
And we just want to reassure you that we are still practicing all of our enhanced safety protocols that we started when we opened back up back in May. We all wear masks when we are together. We all wear masks when we're in front of patients. When the providers are treating you, you will always be asked to come into the practice with a mask on. And then they will wear an N95 mask when they're treating you, along with the face shield if that's appropriate, especially some of those procedures where you are aerosolizing things from photofacials or halo treatments or hydrofacials and things like that may be contaminating the air with droplets. So we are really, really cognizant of that. And we want you to be safe and also feel comfortable. We also ask that you not bring in your children or anyone else with you, because we're really trying to limit your contact with other people. We've asked everyone to please call or text us when they come to our practice from their car, and we'll let you know, please come up to the door, because we don't want Unfortunately, we would love to have all of you in our waiting room and chit-chatting all together, because that's why we love coming to work and seeing all of our patients. But unfortunately, in this day and age, we've got to bring in one at a time. We might have one person sitting way far away and the other person checking out. So just bear with us too when you're in the office with us. I just want to thank all of our panelists. Y'all are great. Our providers are the best in town, and our staff is the best in town. And so you can't go wrong coming here. You know, you have Dr. Mason to back up anything that they are doing here. Dr. Juan is his partner here at Southlake Plastic Surgery. She's also very knowledgeable about all aesthetic procedures. And we work as a team. Someone you haven't seen tonight is Christy Sacalera. She is our front office coordinator here at the Med Spa. She's the beautiful face you see when you walk in, and she's the voice you hear on the phone. So she's been tirelessly working behind the scenes and helping me with the drawing. The other thing that you may be asking about is pricing, and I forgot to mention this earlier, but if you go to our website, southlakeplasticsurgery.com, we've got a shop button. On that shop button, there's a drop down, and it says Southlake Skincare. If you click on that, you are actually taken to our web store, and they can fulfill any orders. For example, if you're out of town and you know you want to try a great sunscreen, they even have trial sizes for sale. You can buy those online, and then they'll ship it directly to you. But it is our branded sunscreen or our branded facial cleanser. You're always welcome to call us for a virtual consult beforehand, so you know you're ordering the right thing. But that's also a good way to see what the pricing is. You can see what everything is priced, including the trial sizes, because unfortunately they do charge for that. But you can look at all the pricing on the website. If you want to go directly to that site, it's shop.southlakeskin.com. So, but you'll see it on our website. I think it's easier to just go on there.
I was just going to add a little note about our sunscreen. So I mentioned it's all completely mineral. There's no chemicals in it, but the biggest component of it is zinc. It's over 20%, which is pretty good for a sunscreen. Usually you get somewhere in the teens with something like Elta MD. We are in the season for maskne. That means our masks are causing acne on a lot of us. I've been seeing a lot of acne cases coming through. Background is I worked for a dermatologist for a long time, so I do treat acne here as well. The zinc is actually antimicrobial, meaning it kind of almost acts like a topical antibiotic and helps you not break out. So great time if you're looking to make the switch to a sunscreen to try this purely zinc-based one. One, zinc is great. It bounces that sun right off. Your skin won't heat up like it does with a chemical sunscreen and stimulate any of that melasma if you're a melasma sufferer. But also you're getting that protection from acne while we're wearing the masks for the foreseeable future.
Great. That's a great point, Amy. Again, thank you guys so much. We can't wait to see you either virtually or in person, and any one of our wonderful staff members can help you. We have one question. Does your makeup stay on with the SPF?
Mine does. I use it and mine stays on. I actually in the summer just use that SPF. I love it. It has really good coverage.
And does it feel greasy or heavy at all?
Nope. Not at all. I'm sorry, I just jumped right in to answer this one, but I can tell such a difference. I've tried the Skin Medica Total Defense and Repair, the Elta Clear Tinted, and I like both of those. I've recommended those, but this one just has more of a velvety matte finish to it. It has, it just has better coverage, and it's not oily or greasy. I love it. I love it. It was a game changer for me.
Do you use the tinted or the untinted, Lindsay?
I use the tinted, but I also have obviously the melasma and some acne scarring as well. So I love the tinted, but that's all that in the summer, that's all I'm wearing for makeup is the tinted sunscreen. And in my opinion, that's the goal. If we can get your skin to the level where you feel confident wearing a tinted sunscreen and that's it for your makeup, that's the goal. If you're still wearing makeup, of course, if you're wanting to feel your best on your makeup, whatever, I've done that too with this sunscreen and it goes on great on top.
Great. Thank you so much.
And one other thing I wanted to throw out real quick, but if anybody is wanting to come in for Botox, ownyourlook.com is giving away unlimited $50 off Botox injections right now. So ownyourlook.com if you're interested in that for $50 off Botox.
Follow us on social media. We have a pretty active Instagram account. We're on Southlake Plastic Surgery, Facebook. Thank you guys so much for joining us tonight. We hope this was helpful, and we cannot wait to see you guys. Have a great evening and stay safe.
Thank you.
Bye.
Good night.